and welcome to Wellness Wednesday. My name's Amy. I'm an Administrative Services Manager here at Baggett. It's March. I don't know how that happened so fast. I know February's shorter, but it just seems like March was suddenly here. Poof. It's my birthday month, which is always exciting for me. And yes, I make it about an entire month. You should too. We should celebrate birthdays. They're very important. March has a couple of awarenesses that I wanted to talk about. Awarenesses? Is that all right? Cancer awarenesses? Sure. It's a word now if it wasn't before, but I think it is. Anyway, March is kidney cancer, multiple myeloma, and colon cancer awareness month. So these can be a little tricky. Colon cancer, there are screenings you can do and that you can do regularly. Of course, there's a colonoscopy, and that is recommended over the age of 45 for you to get. And then there's Cologuard, where you basically just send everything in a box. It's kind of fun. I had to do that one this year, even though I was a little past my date. But I thought it was 50, but apparently I was wrong. Anyway, check with your doctor and what they recommend for you. You don't want to do Cologuard if you have any family history. If you have a history yourself of any type of inflammable bowel disease or anything going on there, or adenomas. If you have anything like that in your history, then you're going to want to go with a colonoscopy and not do the Cologuard. But if you have no history, you're just an average risk, talk to your doctor about the Cologuard. So that one's something that you can do a regular screening. Things that you're looking for, especially if you're worried about colon cancer, are change in your bowel movements, a lot of stomach pain, and blood in your stool. Those are things that you kind of want to keep your eye out for, and then make sure you mention to your doctor. With kidney disease, or kidney cancer, it's very different. There isn't a screening that you can do regularly. Really, the only way they're going to catch it, there's some blood work they can do. They can do a CT scan. That's all going to kind of come after you're already having symptoms, though. So make sure to check with your doctors, especially if you have blood in your urine, a lot of lower back pain that can't really be explained, if you have a mass or a lump on your side or your lower back. Make sure to be talking to your doctor so that they can do some of those extensive screenings that they're not going to do just on a regular basis. Same with multiple myeloma. Things that you're going to experience there are bone pain, low kidney function, frequent infections. Those are things to kind of keep in mind and talk to your doctor about. Again, there's not a regular screening that they can do for that, so you want to be watching for the symptoms. Of course, if anything's not feeling right with your body, if you are having anything that you were normally doing that you're suddenly not doing, or if something's making you far more exhausted than it used to make you, you used to be able to go for a walk easily and now suddenly you're tired or out of breath, or again, any of those kind of daily habits of yours that change drastically in timing and frequency and the way they're happening. If there's blood anywhere there shouldn't be, please talk to your doctor, because there are so many other things out there that it can be possibly, and we want to keep you as healthy as possible. But in all these awareness months, make sure to do a little research, look up some things that you can do to help prevent these cancers, some signs and symptoms to look for, and then make sure if there are screenings you can get, that you are getting them. Have a fabulous week, and we will see you next week.